A community health worker is a person without formal medical training who serves as a liaison between the clinician and the community at large.
We're individuals that provide our members, patients with resources. We're the ones that go out there and find these resources and try to provide them to each one of the members that we have contact with.
A community health worker is someone from the community of the patient that they're serving. They have similar life experiences. Community health workers speak the same language, and that also can look different. If they're from the same neighborhood as you, they're going to speak the same lingo, which patients relate to, but sometimes they actually speak the same language.
We are bridging the gap in the communication between the patient and provider. We'll be able to explain that in their own language with no medical terminologies, so a way that is going to be easy for them to understand.
I primarily work with the Burmese population. The health clinic, it's different for where they're from.
There was a mom that didn't have transportation, so I, was able to get that transportation in place so that individual can get from A to B so she can go to her doctor's appointment.
The best literature out there on community health workers suggests that they not only improve adherence to therapy, like drugs, but they also improve the likelihood of people sticking to behavioral change plans. Think diet, exercise, smoking less, and drinking less.
This is a workforce that is needed. It's necessary. Patients actually relate better to this workforce. We have them embedded in safety net clinics. We partner with community-based agencies or community-based organizations. We also have them embedded in hospitals. So we're working with the providers, the doctors, the nurses, and the social workers within those settings to identify those patients so then we can link them to care. And more recently, we've started working with insurance companies. So how do we take patients that are high utilizer of an insurance company and identify ways that we can impact their health? So it's going to drive the cost down to the insurance company, but also the overall healthcare system, and a patient will get healthier.
One day can consist of assisting new moms with breast pumps. One day can be providing education to members that have diabetes. One day can be assisting members with case management.
The first thing that we notice is the trust. They feel that they can come to us and ask anything. And in the most cases, we learn that people is very eager to learn.
Some of the value that we see in utilizing community health workers, one is an increase in patient satisfaction, which I think is huge. If you're a patient and you're utilizing the healthcare system, you want a patient to be satisfied. If they're satisfied, they're more likely to adhere to the medical recommendations that they've been given. You also see a reduction in healthcare costs. So at our hospital systems, you see about a 70-ish% reduction in emergency room utilization and about a 50% reduction in the length of stay for patients that have been admitted to the hospital.
Cuando yo caía aquí a este programa con ella, para mí todo ha cambiado para mejor vida. Y siento que ella me ha ayudado mucho diremos como en cuestión de conseguir doctores, conseguir como lugares, más que nada para aprender algo que a mí me hace falta, aprender cómo mover una computadora, lugares donde yo puedo ir a hacer ejercicio, puedo ir a platicar, hacer amistades. De este seguro que he agarrado y los que me han ayudado, todos para mí han sido muy buenas personas, excelentes, incluyéndola a ella, más que nada.
The biggest role is that connecting them to the resources and help them with what they need,
To create a legacy of healthy living in the community, we want to pass healthy information to each individual. So this individual will pass it on to their kids, apply it to themselves, then to their friends, to the neighborhood, and then to the community.
I really like to look at them as an extension of what is being provided, but the true work and what they're doing that's different than what already exists is they're going into the community. So they're going into the home, they're going to the social service appointments with patients.